Hello, my name is Jaleesa Wright. I'm a student physical therapist, and today I will be taking my patient through a series of exercises based on her condition. So to start, I'm just going to read off her case. So my patient is a 34-year-old female who was in a motor vehicle accident 2 weeks ago where blunt force was applied to the anterior aspect of her left knee. She has been complaining of left anterior knee pain since the accident. She also complains of instability and pain, which is increased with weight bearing and negotiating stairs. She has pain at end ranges of knee flexion and extension. Her past medical history includes controlled type 2 diabetes. She is 5'7" and 200 pounds. She reports her pain at rest is 3 out of 10 on VAS and 7 out of 10 at worst on VAS. Her current BMI is 31.2, which places her in the obesity 1 category. So before we get started with any exercises, I would have my patient complete a thorough warm-up. We would do a warm-up on the recumbent bike for 10 minutes at a resistance of 2. And if we needed to decrease or modify that warm-up, we would just decrease that resistance. So the first stretch I'm gonna have her do is a standing quad stretch. So I'll demonstrate that right now for you. So what you're gonna do is, you can use the table for support, and we'll raise it so that it's comfortable for your height, appropriate for your height. And you're just going to use your left leg, grab your foot into your hand, and you're gonna hold this stretch for 45 seconds, and we're gonna do that 3 times on your left leg, okay? And I'm gonna go ahead and demonstrate the next stretch as well. The next stretch we're gonna do for her is a long sitting hamstring stretch. So for that, I'll just have her sit on the treatment table with that left leg extended out, and she'll just lean your trunk forward and kind of try to reach for your toes and hold that stretch for 45 seconds as well. And we'll do 3 sets of that one as well. So first, let me just raise the table height for you. Does that seem like a comfortable height for your hand? If you need a little height, that's fine. Okay. You just want to hold it there, and I will be palpating her quadriceps muscle here just to make sure that it is properly lengthening in that area. And like I said, we would hold for 45 seconds, and she would do it 3 sets on that left leg. And if she needed to take a rest break in between those sets, we could do that as well. Okay, 45 seconds has passed, and we'll just pretend for the sake of the video like she's done her 3 sets for that exercise. So for the next stretch, let me lower the table just a tad for you. I would also make sure to ask her about any pain that she may be feeling with that exercise. So yep, you're just gonna do that, and go ahead and lean forward for me as far as and if you don't mind me touching under your leg here, I would just palpate in this general area underneath her leg where her hamstring muscle is, just to kind of see how tight it is or how much lengthening we're able to get in that muscle. And like I said, she would also hold that for 45 seconds. And I don't know if I mentioned it, but for both of these exercises, if we needed to modify, we would just have her hold for 30 seconds instead of the 45. So those are my 2 stretches. You can relax, and I'm gonna move on to my exercises. So my first exercise is gonna be a standing gastroc stretch. And once again, we will do 3 sets of that, hold for 45 seconds. So I'm gonna demonstrate that for you, okay? I'm gonna release this just a tad. Okay, and what you're gonna do is bring your left leg back and try to keep your knee straight and keep your heel of that left leg on the ground. And with your right leg, you're gonna kind of bend and lean into it until you feel a nice stretch right along the back of your leg here. Okay. Yep, and we want to make sure that we're keeping our hips neutral. Make sure she's not arching or doing anything funky with her spine. And yeah, as long as her knee is straight and her heel is on the ground, we're sure that we're lengthening the gastroc muscle. So I would have her hold that for 45 seconds. If she was unable to do that, we would modify down to 30 second hold for that as well. So that's perfect. I feel like I'm going really fast. And then my next exercise is gonna be the supine hamstring curl. So this is gonna be an isometric hold for this. So I'll just demonstrate that for you. We're gonna have you lie on your back. And with your left leg, I want you to focus on keeping your toes up toward the ceiling, but digging your heel of your foot into the treatment table. So I'm relaxing here, and I'm literally just gonna dig my heel into the table. And you should feel a nice strong contraction on the back part of your thigh. That's gonna be your hamstring muscle working, completing that exercise, okay? So we're gonna do 2 sets of 10 reps for this exercise. And once you dig your heel into the ground, I want you to try to hold it for 5 seconds and then release it, okay? So we're gonna go dig your heel into the ground. 1, 2, 3, 4, 5, and relax. Okay. And as a modification for this, I would have her, I would decrease the amount of reps. So we would do 2 sets of 5 or 2 sets of 8, whichever one she felt like she could complete correctly. Yeah, you can straighten that other leg. Toes up toward the ceiling. And I'm just gonna place my hand here to feel that muscle contraction on your hamstring, okay? So go ahead and contract. Push your heel into the ground. Hold 1, 2, 3, 4, 5, and relax. And I can feel her hamstring muscle working, so I know that she's doing the exercise correctly. And she would do 10 or 9 more of those in 1 more additional set, like I said. And if we needed to modify, we would just have her do 8 reps instead of 10. Okay, so the next exercise, we're gonna actually utilize this step stool here. So you can just watch me complete it first. Excuse me. So what we're gonna do is, I want you to, you're gonna just step down. You're gonna have your right leg out in front, and I want you to tap your heel to the ground and come back up. And you can take a little rest in between each one. Tap your heel down and come back up, okay? And for that, we're gonna do 8 reps with these 5-pound weights. I have a few different ways we could modify this. We could either take the weights away, and then we would just have you maybe place your hands on your hips and do here. Or if the step was too high, then we could just modify it an additional way and just do a single leg squat like this. So we would just kind of see how she does with the 5-pound weights, and then if we need to decrease it from there, we would do that. And for this exercise, when she goes to step down, I'm gonna palpate her hamstring. And when she goes to step back up, I'm gonna palpate her quadricep muscle. Yep. Okay, so I'll just have my hand on the front and the back of her leg, making sure I am also supporting her. So, great job with that. So we didn't need to modify that one, but you see how it can be modified. And then for our last exercise, we're going to do a prone hamstring curl. And I'm going to do it, we're gonna try it with the green resistance band first. I can't really demonstrate this one on my own, so what I'm gonna have you do is lie on the treatment table on your tummy for me. And I'm just gonna wrap the band around her leg this way and add a little resistance. And what I want you to do is pull your heel in towards your butt for me. Yep, and relax. So we would just have her complete 3 sets of 10 of these hamstring curls with the green band. If we needed to modify it, we would move down to the yellow band, which is a little bit less of a resistance. So go ahead and do a couple more for me. Yep, perfect. And I would still be palpating her hamstring. I can feel it contracting. So she's doing the exercise appropriately. And you can relax. And throughout all of these exercises, I would make sure to monitor her for signs and symptoms such as excessive sweating, heavy breathing, dizziness, lightheadedness, anything to that nature. And I would also be sure to ask her RPE throughout the completion of these exercises to make sure she stays within an appropriate range, because we do want to make sure that we are keeping those things in mind because of her weight and her being in the obese category. And I think that concludes everything. So